Hi, good morning, everyone. Good afternoon from where you're watching us from. Welcome to today's webinar by Nursing Now Challenge. We are going to tackle advanced nursing practice, the key to driving UHC across Africa. My name is Cecilia Ndongo. I'm a registered nurse in Kenya and the co-chair in Nursing Now, the Afro Region Hub. With me, I'm with my team, and I'd like to introduce them. We have the first speaker, we have Faith Nawagi. Maybe probably she could unmute and introduce herself briefly.
Hi everyone. Thank you, Cecilia. My name is Faith Nawagi. I'm a nurse midwife based in Uganda and currently a PhD scholar at Makerere University and dabbling as a co-chair for the Africa Nursing Now Challenge Regional Hub. Thank you, and over to you, Cecilia.
Thank you, Faith, for that introduction. Our next speaker is none other than Professor Ndirangu. Kindly unmute yourself and do your introduction.
Hi, everyone. Good morning, good afternoon, depending on where you are. It is a pleasure to be here. I am Eunice Ndirangu. Just call me Eunice. I am the Dean Aga Khan University School of Nursing and Midwifery, but also the Chair of Nursing Council of Kenya. Thank you.
Thank you so much, Prof. We also have the other co-chair, Mohammad. Kindly unmute yourself and introduce. Mohammad? I think he's on mute. Mohammad, can you hear us? Okay.
Yes. Hello, everybody. Good afternoon and good evening to everyone. My name is Mohammad Mudabat. I'm a co-chair of the Africa Regional Health Challenges Committee. I'm a registered nurse from Sudan, community health nurse by background, and one of the immunization advocacy champion with Nursing Now Challenge. It's my pleasure to be with you today. Back to you, Cecilia.
Thank you so much, Mohammed. Our other regional co-chair, we have Rashid. Kindly unmute yourself and introduce yourself.
Hello, everyone. Sorry, I've been traveling. I'm Rashid Manganda from Malawi. I'm also a co-chair of African Challenges Committee. Thank you so much to be with you all. And sorry, just to mention, the Director of Nursing and Midwifery Services in Malawi is here to join us. So I'll send the email address to Hannah so that she can forward the link. Sorry for late confirmation.
Thank you so much, Rashid, and we'll be glad waiting for her. Sorry. Going forward, we'd like to start our program for today, and a few etiquette. We'd like to keep, we have the Q&A session. Kindly, if you have any question, kindly feel free to put it up there, and we'll be able to respond. Our first speaker, welcome, Faith Nawagi.
All right, thank you so much, Cecilia. Colleagues, I'm going to use a few slides to pretty much articulate what I'll be talking about. I'm going to turn on my video so that you can see who is speaking and all that, and so that you're really well aligned to whatever the discussion is. So is everyone able to see my screen, hopefully?
Yes, we can.
All right, okay. So my name is Faith Nawagi. I'm a PhD scholar currently at Makerere University, and I'm a Ugandan, and I'm a nurse midwife by background of training. So today, I think our major topic today is to understand advanced nursing practice and its reality here in Africa, and what needs to be done, what needs to be advanced, but where are the gaps and how do we work together to address them? I'll begin by defining who an advanced practice nurse is. And these are commonly referred to as APN. This concept in Australia, in the UK, and in the US, it's quite a common title to have. And in fact, in terms of their registration of certificates or licenses for practice, there is a category for advanced practice and advanced practicing nuns and all that. So, but here in Africa, trends are pretty different, and it depends on which country and all that. So I'll begin by enlightening that an advanced practice nurse is a nurse with a postgraduate education and training in nursing. And by the time I say postgraduate, in this case, I mean training at master's or PhD level or a doctorate level. Postgraduate education is not having 2 diplomas or having another postgraduate diploma. In this case, for this category, there is a requirement that this kind of training is at a master's or a PhD level. So nurses practicing at this level may work in either a specialist or a generalist capacity. And as a result, these kinds of nurses are prepared with advanced didactic and clinical education, knowledge, skills, and scope of practice in nursing. So beyond just their preliminary training at bachelor's, they have an advancement of specialization in a particular area and field of nursing care and practice across different countries. So when we talk about advanced nursing practice, there are pretty much 4 pillars. And in this case, it means we can have advanced nursing practice in the clinical practice, in the clinical domain. In other words, in the hospitals. We can have this in the concept of leadership and management, especially in the various levels of nursing governance at policy level, as well as in different levels of education, even in the health center and facilities where nursing leadership and management is actually key. We also see this in education, whereby we see that we have nurses with master's and PhD level taking on training for the nurses at various levels. The key aspect that drives evidence for all the other 3 pillars mentioned here is the concept of research, where we see that it's important for nurses to participate in research after having gained expertise at the level of their master's and PhD level, to drive innovation in the various fields of practice of nursing. It could be education, it could be in the clinic at the front line, in education, etc. So the reality of advanced nursing practice in Africa, and I believe our other colleagues from Kenya and Malawi will be able to articulate their country-specific situations, it's still an area that needs to be advanced. If we look at the current nursing health workforce across Africa, majority of them, according to the Hexacon report and that report produced by the World Bank recently, you notice that many of the nurses that are practicing are still trained at a diploma level, and a few are coming up at a bachelor's level. This doesn't mean that there are no nurses trained at master's level like myself or PhD level. They are there, but their availability and all that is still very low. And also the scopes of practice in the various African countries are pretty much lacking the key standards of practice for this kind of level of nursing cadre, in the sense that we've recently concluded a study to understand the nursing leadership and governance across Africa, and we included 16 countries. Specific to this is something called the scope of practice that really defines what does a nurse have to do in line to the level of education that they have. And when we looked at these scopes of practice, majority do not differentiate between a diploma nurse or a bachelor's nurse. It is all nurses, and then they say the nurse is called a registered nurse and they'll be doing this, and then a midwife will be doing this. But yet, at the education side, we are training people at certificate level, diploma level, bachelor's level, and as well as master's level. So the question here is the lack of proper linkage of the education side to the practice side, then therefore develops a problem for people to practice in this level of advanced practice now, simply because it's not being well articulated. However, a few countries have made some progress. I think Kenya's currently updated scope of practice has a bit of description in this, but majority of the other countries still have a lacking. And also the fact that in Africa, we have this situation where specialization is being done at diploma level. It creates a hindrance for career growth to advanced levels in such a way that if a nurse can decide to do a diploma in nursing, then do a diploma in psychiatry or a diploma in midwifery, at the end of the day, they are doing horizontal career growth. And we should also emphasize that nursing is an equal discipline or profession like any other in the health sector that requires growth in a vertical manner, in the sense that specialization should be at master's level. And with that said, you also notice that a lot of our education domains actually have lack in different disciplines for mastering in nursing. A few are existent, but many times the different specialization areas are always few and require many of the nurses maybe to go out of Africa and train from elsewhere and things like that. But the domain is changing, and we hope that there is an articulation that advanced nursing practice should be at a master's level, and therefore there should be a linkage with the education side as well as the practice side to ensure that we harmonize the different roles of the different nurses, including the recognition that a nurse who has a master's is an advanced nursing practicing nurse, and therefore their schemes of service in terms of remuneration, their roles in the hospital should be really reflective of that than us being at the front line. And when we are giving nursing care, there is no difference between a diploma or nursing or master's nurse, and we are all nurses. So if we link advanced nursing practice to universal health coverage, which is really all about that all people have access to health services they need when and where they need them without financial hardships. The question then, in terms of linking advanced nursing practice to universal health coverage, I'll bring it back to the reality that nurses make the biggest part of health workforce here in Africa, and therefore to advance healthcare, lots of evidence generation is required through research, leadership, and specialized care. So nurses being at the front line would be key in actually advancing universal health coverage through ensuring that we have evidence-based knowledge generation through the component of research. The fact that we are at the front line, we pretty much best know how to address issues, and it would only be much more better if we contribute to this evidence as nurses, given the fact that we are actually at the front line. But the gap is we lack the ability to conduct meaningful research through lack of advancement of research skills at various levels, and also through lack of advancement to the advanced nursing practice level. I'll end my talk at that, and over to you, Cecilia. Thank you so much.
Thank you so much, Faith, for that wonderful presentation. And I believe we have so much to be enlightened. And I'd like to welcome Professor Ndirangu, our next speaker. Karibu, Prof. Prof, kindly.
Thank you so much, everybody. Just 2 seconds, let me share my screen. Let me know if you can see my screen. Sorry, 1 second.
As Prof prepares her setup for the presentation, I'd like to introduce also our new guests. We have Lucy. Kindly unmute yourself and introduce yourself to us. Welcome, Lucy.
Hello, I am Lucy Kutumura from Malawi. I am Deputy Director of Nursing and Midwifery Services. I'll be joining you on this discussion today, and it's a pleasure. Thank you so much.
Thank you so much, Lucy, and welcome to the panel.
Thank you.
Sorry, I'm trying to share from my iPad and it doesn't seem to be working. Do you want to proceed and then I'll try on my laptop? My apologies.
Okay. We can proceed on with a brief presentation from Lucy, what she has to tell us about, and welcome, Lucy.
Thank you. Yes, I was asked to look at the universal health coverage and the role of nurses. I will be talking about the Malawi perspective, but basically I'll be talking of the general picture about how the role of nurses impact on universal health coverage. So I also prepared a presentation. I'm not sure if I just need to also share it. Just a minute, let me try to share that. Yeah, so basically what I'm saying is that it's unfortunate that it can't move, but oh, wonderful. So the World Health Organization defines universal health coverage as a means that all people have to access to the health service deliveries they need, when and where they need them without any financial hardship. Basically, this means that we must be available as health workers at the point of need, so that we reduce the traveling that is involved when one is looking for health services. And currently, at least half of the world population do not receive the services they need, or in other ways, they are underserved. And such groups are either in hard to reach areas or sometimes even hard to staff facilities. Over 100 million people are impoverished as they spend on access to healthcare. And the majority of these people that have problems to access healthcare are in sub-Saharan Africa. And the International Council of Nurses in 2019 shared its perspective on how nurses play an important role in universal health coverage. And at that time, ICN was saying that nurses make up to half of the world's healthcare workforce, and that the nurses are the ones who do most of the work in health service provision. In Malawi, we are talking about 80% of the technical workforce that is made up of nurses. And then currently, the world is faced with a dual burden of communicable as well as non-communicable diseases. As you know that we are as nurses, we are already at the front of this particular fight. Therefore, nurses already have the skills that they need to actually fight both burdens. What makes a nurse unique, a unique profession for universal health coverage? So what we are saying is that nurses can work at any level of healthcare from primary to tertiary level. And nurses at the same time can provide hospital-based care as well as community-based care or home-based care. At the same time, nurses can work in various setups, such as schools, workplaces, prisons, and many other places where, as far as need is concerned, nurses can always move and work in those places. You must also know that nurses can work in emergency response teams as well as camps during disasters. And we have just seen this as Malawi. The moment we had disasters in terms of floods, we also have had the COVID pandemic. It is the nurses, the nursing team that has been on the forefront in these emergency response teams. As we are talking now, we still have sporadic cases of COVID, and who is at the bedside now? It is the nurse. The rest of the teams have migrated to other duties, but the nurse is still at the bedside taking care of the last patient that will come to the COVID-19 unit. Furthermore, nurses provide care to any age group. So from birth, even from conception, actually, up to aging and up to death, the life continuum, nurses are there all along that continuum. And as well, nurses work with people in any state of health. So nurses will work with people who are either sick or well, and that places the nurse as a unique cadre that will actually provide, very important to provide universal health coverage. As we are saying that as nurses, we are all over, we even provide promotive care, preventive, curative, rehabilitative, as well as palliative care when somebody is now just waiting for the actual time when they can depart from this planet. The nurses are the last health workers that are at the bedside of such patients. Therefore, as described by the International Council of Nurses, nurses are intrinsically linked to a country's ability to address health priorities. And therefore, to conclude, I should say that going towards 2030, we need just to change from a focus on hospital-based services to community-based services. We need to strengthen our community-based services, and so that we can help to achieve the target for 2030 in universal health coverage. Nurses have the capacity to change that trajectory, and therefore the future of health services delivery is nursing and midwifery. Thank you so much. That's what I wanted to share with you.
Thank you so much, Alice, for that wonderful presentation. And I believe there's much insight that we need to share as an African content towards advancing the nursing practice in Africa. To our next speaker, I'd like to invite Prof. I hope the setup is okay now. Welcome, Prof.
Thank you very much, Cecilia. The setup is spot on now. My apologies. As you can imagine, technology just has a way of taking control and reminding us who is in charge. I hope you can all see my screen. It is indeed a pleasure to be here today. There's always an internal joke for those who know me. I did the Advanced Nursing Practice program in the UK in 2004. So please don't calculate how old I am. But for me, it's the joy of seeing us come to this point in time when you're talking about advanced practice nursing and making it a reality, particularly in the African region at large. So for my presentation, I'll try not to repeat elements that have been presented because I think we've talked about the definition of APN and what that means, so I will not do that. But in essence, I'll look at the background, look at the prospects in Africa, think about the prospects in Kenya. My team and I at AKU School of Nursing and Midwifery, that's Aga Khan University, did do a gap analysis, a scoping review, and an initial formative research around opportunities that exist for APN. So I'll focus on some of those findings to sort of put to the fore what the realities are in the Kenyan context, but most importantly, the limitless opportunities that exist if you're talking about universal health coverage. So by way of background, we know the nursing profession enhances access to quality care, affordable care as well. If you go to countries where there is huge growth in nurse-led services, we know that those services are of higher, if not equal quality to those provided by our medical colleagues, but also at an affordable price, but also increased in terms of access. The 21st century, of course, is showing a growing need because we have an aging population, but there's also increased focus on rural and marginalized areas. And if we're looking at the Kenyan context, and I think in Africa at large, we are seeing there is non-communicable diseases, communicable diseases, as well as emerging diseases, as we saw in the case of COVID. We do know that there's a need for enhancement in order to meet the demands of the population. And as has been said by the two previous speakers, we know nurses and midwives in the low middle income countries do perform advanced roles. They may not necessarily have been trained for it, but they do perform those advanced roles. And we can't go without saying that nurses in advanced practice generate clinical outcomes that are comparable to those of physicians in all clinical settings, particularly emergency and critical care settings. And there's quite a bit of evidence to demonstrate this, but largely from the West. So this is just the global picture of the reality of the ratio of nurses to patients where we live. And if you look at the African continent, it's all dark red. I think that's the color. And you can see that essentially means for the majority of our countries in the region, we have less than 10 nurses for every 10,000 patients. And like in the case of Kenya and some of the other countries at the central part, it's between 10 and 19. And that is really, really such a huge disparity when it comes to needs. Yet we know nurses are the majority healthcare provider, but they are also often the only point of contact to the majority of the population. The shortages are not just related to the numbers, they're also related to distribution. For instance, if I use the case of Kenya, the majority of nurses and midwives are located in Nairobi, while the rest of the country has to share the remaining number. We know that approximately 89% of that shortage is concentrated in low middle income countries. And like I said earlier, nurses and midwives are usually the first and often the only point of contact with a trained health professional. So if you look at the APN prospects and the realities as they stand, we see nurses in sub-Saharan Africa regularly practice outside their scopes. We know APNs and NPs practice in some of the countries like South Africa, Togo, Angola, Kenya, Sierra Leone, Tanzania, to mention but a few. And then we know that the reality is that existing benchmarks of practice are largely drawn from the Western philosophy and materials. And the key question for us is, we're thinking about universal health coverage, is what should an APN in this part of the world look like? And that's what we really need to ask ourselves. Do they need the same set of skills? Do they need additional set of skills? What more do they need in terms of competencies, whether it's cognitive ones or metacognitive ones? So when we did this, the review of sort of like the gap analysis as well as the scoping review, as has been said by the previous speaker, of course, we lack regulation in most of sub-Saharan African countries, lack of advanced training, and then nurses are performing advanced roles or what would be considered as advanced roles. But we also know that there's no definite or uniform entry requirement and training guidelines. And so we all define different things and mention different things as being advanced practice, but not necessarily an aligned definition or an aligned training. And we did get into a lot of arguments and discussions, particularly when we were working on the scope of practice for APN, APM in Kenya, because somebody would ask, so what's the difference between a person who's done a master's in critical care, for instance, and a person who's done a master's in advanced practice nursing adult health, for instance, and sort of defining what it is we mean by APN or NPs in this part of the world. So as we continue to see nurses practice at advanced roles without necessarily the supportive legislation at the time when we were doing the gap analysis, and of course, we tried to map out what are some of the roles that the various people thought constitute advanced practice. And then, of course, there was, benchmarking in terms of what are the existing philosophies and what are the existing tools that define APN. And without saying it, we know the health workforce development needs to meet the demands of increasing population. And this is a key opportunity that APNs can actually fill in. And So looking at the summary of this is that we know the context of the growing population needs, changing needs, but it's the opportunity that exists for us to leverage on advanced practice roles in order to achieve universal health coverage. And a key element for me, and this is why this webinar today is so important for me, is the opportunities to collaborate between countries. I was fortunate to be involved in the Anglo-speaking countries collaborative team that was working on the prospects of an APN role in the English-speaking African countries. And for me, what caught my attention then was the collaboration. And I'm hoping that's a collaboration that continues, especially as we figure out how to make this work for us in this part of the world. So it's always easy to think about problems and think about what's not going right. But I think a key question for us and for me always is, what opportunities exist for us? So I would say if you look at the Kenya Health Policy Framework, it talks about the priority needs for the population when it comes to healthcare right now and in the future. And those are areas that are listed that can kind of guide how we frame the APN programs in this part of the world. Thinking about strategic partnerships and alliances as well. Thinking about how and what contribution can APNs make in or towards the SDGs and UHC. And I think that the speaker immediately before me spoke about the emphasis on primary healthcare and location of nurses and midwives in the primary healthcare setting, so that then we are able to meet that demand. So it's not a question of whether that is needed. I think the question is, how do we operationalize it? In Kenya, we've already seen the early steps towards institutionalization of APN, APM. We now have a scope of practice by the Nursing Council of Kenya for the 2 programs. And we're now also working towards developing a scope of practice for the clinical nurse specialist as well. And that needs to be matched by a scheme of service or a job categorization that then recognizes the role of nurses who remain in clinical practice and want to advance their role. Then, of course, population needs will guide how we then conduct the training and where APMs are placed. And I think it's important to generate evidence of effectiveness of APN and APM in this part of the world. And I'm really privileged and honored to have won the Low Middle Income Country Grant Award at the recent ICN APN NP conference. And for me, the work that we are doing with the team on the ground, both at the Nursing Council and the School of Nursing and Midwifery at the Aga Khan University, towards generating evidence of APN and APN in this country will be critical to figuring out how that role then fits based on evidence in terms of meeting the universal health coverage elements. And of course, as a woman who's a nurse and in leadership, I never hesitate to mention the opportunity that exists to build more women, nurses, and midwives into senior leadership positions. In as much as over 89% of the nursing and midwifery workforce comprises of women, only about 25% hold senior positions and are in positions of making policy. And I think for me, APN provides an opportunity to develop leaders and clinical leaders who are able then to influence and impact positively on healthcare in the country. So allow me to talk a little bit about how we've developed our advanced practice nursing and advanced practice midwifery program at Aga Khan University School of Nursing. And some of the key elements that stand out for us and we speak about and include in our curriculum. One is research and evidence-based practice, the issue of clinical leadership and collaborative practice, and direct clinical and community practice as well. There are other additional elements around diagnosis, admission, discharge, consultations, but we also talk a lot about caseload management and research and clinical education in a collaborative multidisciplinary team. And for us, the emphasis in the training around here are issues around ethics and integrity, issues around clinical practice that is sort of guided by clinical judgment, critical thinking, and sort of thinking about the nurse in practice as a major problem solver, not necessarily somebody who relies on somehow the health system making sense for things to start working, particularly within the realities of the resource constraints that we know are the hallmark of a lot of our healthcare systems in this part of the world. And of course, using the primary healthcare approach and health promotion as a guiding principle. So the implications and the expectations, of course, is that we do know improved quality of care is one critical expectation, improvement in health promotion, but contribution to the recruitment and retention of nurses in the workforce. There's a team in Kenya that had been working towards reviewing the scheme of service for nurses, nurses and midwives, so that we see if we can retain nurses and midwives in clinical practice and they get the required remuneration and recognition, so that we do not take away the best from practice into leadership or other roles or away from the nursing and midwifery profession. The expectation of decreased lengths of stay in hospital, but also reduction in readmissions, but also admissions. Because if you are going to provide care at the primary level, it means then that you are reducing the number of hospital visits, but you're also emphasizing on prevention and promotion, and then reducing the resources that are required for curative services. Of course, an enhancement in health research and training capacity, but also informing training and utilization of the much needed APN to address health workforce in Kenya and Africa at large. In conclusion, although there was no prior scope of practice for APN and APM in Kenya, practicing nurses, of course, always practiced at advanced levels. We know NCK has now developed a scope of practice for guiding APN and APM practice. And of course, this needs to be met in tandem with not just a training, but also a relevant scheme of service, so that scheme can then ensure that nurses who are trained at APN and APM are also getting the remuneration that they actually need in tandem with their role and responsibility. And of course, as an academician, I can't fail to say that further research is needed in order to evaluate the competencies in practice and the impact of APN and APM in clinical practice as well as community settings, and what those health outcomes look like. Thank you very much, everybody, for listening to me. Over to you, Cecilia.
Thank you so much, Prof, for that wonderful presentation. And glad to say that something you didn't know about me, I'm a student at Sonam, and I'd like to pursue the APN program because there's a need in our African content to improve the nursing and midwifery in Africa. And as the only country with a scope of practice, I believe and hope that we'll be able to scale it up to Malawi, Lucy, and to Uganda, and to other African countries. Thank you so much. For our panel discussion, I'd like to invite Rashid. Please take over.
Thank you so much, Cecilia. I have a few questions for our panelists. The first one is going to Professor Eunice. I would like to know how do you think policymakers or the governments need to do to ensure the smooth incorporation of ANP into universal health coverage?
Thank you so much, Rashid, for that question. If I may give a bit of context in terms of how we went about the development of the scope of practice, because you have to have buy-in from the onset, and you have to be able to kind of get people other than yourselves who help you advocate for your case. I think for the case of Kenya, we were extremely lucky and privileged because the Ministry of Health, leadership, the CS at the time, the PS, the Director of Nursing Services were really very committed to supporting nurses and midwives within the country. And what we did do is to put together a technical working group that included a lot of the stakeholders from various, within the nursing profession, yes, but also within other key stakeholders that are critical to what it is that we need to do. So the starting point for us, and I want to thank Johnson & Johnson Foundation for this, was the establishment of what we call the Nursing and Midwifery Alliance in Kenya. And the Nursing and Midwifery Alliance in Kenya has the Nursing Council as a regulator. It has the associations. It has the academic institutions. It also has the Ministry of Health and other key players. I may not have to mention all of them. That being the starting point, we were able then to start with conversations around what's advanced practice nursing and what role would that cadre play when it came into the fore in this country. So, but that being the starting point, by the time we are going through the process of developing the scope of practice, and at the same time, we're also developing the nursing and midwifery policy, which again was spearheaded by the School of Nursing and Midwifery at TKU, funded by Johnson & Johnson, but again involving all the stakeholders in the Nursing Alliance. The nursing policy and midwifery policy also spoke to the issue of APN and specialization at master's level and above. So in the end, by the time our documents were ready, we already had the buy-in, and we were really honored and privileged that the scopes of practice were actually launched by the Cabinet Secretary of Health on 6th May 2022 as part of the celebration of the International Nurses Day. So I would say, get people on your side, include them in the conversations, and ensure that at least there's always a friend to speak on your behalf or to speak for us and to understand what as a profession we want, even as we push for what we need done in the healthcare system. And finally, everybody wants a solution to the healthcare system challenges in this country. Everybody wants that solution, but we all know healthcare is expensive. So if you provide somebody with a solution that is likely to enhance healthcare, but at the same time, be able to do so at a cost that is not necessarily exorbitant, whilst maintaining quality. And we have good evidence about this from the West. We just need to create the same evidence from here. Often, unless there's another reason, often people will want to listen to you and they will want to be supportive of you. Thank you very much.
Rashid, do you have any other question?
Yes, can you hear me?
Yes, we can.
Hello?
Yes.
Sorry, I lost the connection. Thank you so much, Professor Eunice. The next one is for the Deputy Director of Nursing and Midwifery Services in Malawi. I just wanted you to give a perspective on looking at Malawi's health system. What do you think are the barriers to ANP integration into universal health coverage?
Hello?
Hello?
Yes, I hope you can hear me. Can you?
Yeah, I can hear you.
You are asking about barriers to advanced nursing practice in universal health coverage.
Yes.
Yes. So first of all, with advanced nursing practice, it's about the scope of practice. That must be very clear from the beginning, what is an advanced nurse practitioner can do, and that must be developed by our regulatory bodies. And at the same time, in other countries, for advanced nursing practice, they have dual registration between the Medical Council and the Nurses Council. In some countries, the regulatory body is one body, so that is not a big deal. But in the countries like Malawi, we have different regulatory bodies. For nursing and midwifery, it's another one. For medical practice, it's another one. So therefore, in most countries where there are advanced nurse practitioners, they have to have dual registration. But for Malawi, one thing that I also want to make sure that is clearly defined is to look at the current transcripts or course outlines for nurses that have already done master's degrees. Because yes, indeed, we may think that in Malawi, there's nobody who can practice at an advanced level, but the chances are there that some nurses have already done such a course, but because they were not, at the beginning, the course was not called an advanced practitioner course, then we just conclude that maybe they are not there on the ground. And what we ask is to start something that may already have been started. So my argument would be that, yes, we've got a lot of nurses with master's degrees, and these are clinical master's degrees, not just any other master's degree and then you are an advanced practitioner, no. But let's look at the clinical master's degrees. Let's look at what people have already done. Some people have done courses outside the country, and where they did these courses, they may have already qualified as advanced practitioners in those countries. When it comes to Malawi, because they are not registered as such within our regulatory body, we might just have to rectify that problem and give them the right naming. It means that medical council at a point must also come in and look at the same curriculum or transcript based on what was covered. And if there are gaps, it's those gaps that we must address, because we must always know that as people advance, they gain new skills, and those new skills may have been embedded in the type of course that they already did somewhere. So there are so many people coming back from schools outside the country and some within the country. And as you know, Rashid, that our university, Kamuzu University, is already offering a lot of master's degrees in so many clinical, based courses like mental health, like midwifery, like child health. Indeed, what is it that they are covering? If they are covering something that can be trained to make them, practice and at that advanced level, then why not? So it's a matter of getting ourselves, our house in order, and just making sure that people are recognized for what they have pursued. I think I can stop there for
now. Thank you so much, Madam Director, for the clarification. Next one is for Faith. As one of the young African nurse leaders, how do you think other young and African nurse leaders influence advancement of ANP concept and possible integration into universal health coverage across Africa?
Well, thank you so much for the question. I hope I'm able to answer and articulate it rightly. To me, the role of the young nurses, of course, I've always been called young, but I don't know when the young stops, because I feel like I'm growing and things like that, But putting that aside, I think as young nurses, we are the generation that is really providing care in the next few years and things like that. So that means it calls for us to be involved at the central point where nursing practice is being developed or governed in your country. And so that means that young nurses need to be involved in various bodies that bring us together as nurses and midwives of Uganda, of Kenya, of whatever it is, to then be able to influence policy in the sense that we are part of the contribution to developing a schemes of service in our countries that really articulates that if you're an advanced nursing practitioner, these are your roles. If you are a bachelor's trained nurse, these are your roles and things like that. But also there are quite a number of young nurses today that have a lot of good skills in research through their advanced training at master's level in various fields of research and all that. For us to be able here in Africa to really advance advanced nursing practice, we must produce evidence and evidence generated by our own realities here. So once we produce that evidence generated by our own realities here, then it is key for us to in fact, it's not key, it is easy for us to create an evidence-based case to the policymakers to look at revision of these documents and things like that. But also when we look at the role of advanced nursing practice here in Africa, and I will speak to the Ugandan context and looking at the 4 pillars of where advanced nursing practice happens, I think we have seen nurses with a postgraduate education in the roles of leadership, but oftentimes they are few and all that. And even at the point of policy, we've seen nurses with advanced training with masters and all that in the field of education, people growing up to professor level and things like that. We've also seen the nurses with advanced practice of training at the research level, leading different research projects and things like that. I think the biggest gap that is there is understanding advanced nursing practice in the clinical area, in the sense that if I have my master's in midwifery, or if I have my master's in pediatric nursing, how do I articulate that to reflect my roles, and how can that be linked to my education, my scope of practice, and my schemes of service in line to remuneration? I think that's where the gap is. And as nurses, irrespective of young or old, we need to come together and understand, if I have a master's, what is it that is required in the clinical area to advance care? And do we need to appreciate the concept of nursing specialization in the clinical care part? So over to you, Rashid. I hope I've answered you well.
Thank you.
Thank you, Faith. That was wonderful. And apologies for calling you young. You're no longer young, miss. Okay, so I have another question to Madam Director, and I'm just echoing what one of the participants has asked in the Q&A box. David is complaining that male nurses are not recognized in their efforts, are not recognized when they conduct their achievements in nursing profession. How true is it in Malawi?
Hello?
Hello? Did you get the question?
Yes, I heard you that there's a question to say male nurses are not recognized in their achievements.
Yes.
Is it? Yeah, so I think as nurses, we are scientists. So nursing being a science means that we need to bring evidence to the table for us to argue. So that argument can only be true or false based on the evidence. Do we have the evidence?
All right.
Hello,
That's not for me to respond.
Yeah.
I was just echoing what one of the participants was mentioning.
Okay, so why can't the participant take lead and maybe try to come up with a study or some sort of situation analysis that can point to such a conclusion? Then during now the discussion of such a study, we can see reasons why or factors that contribute to such. So for now, we can't say yes or no, because we don't have such evidence to say that male nurses are the ones that are not considered for recognition of their efforts. Over.
Thank you so much, Madam, for the clarification. I think David is satisfied in your response. And the last one is going to Professor Ndirangu. One of the participants is also keen to know how far. So I'll just read the way it is. How far have they reached in terms of advocating for APNs to be recognized in Kenya? Because what we see now is whether you are trained at a PhD or master's, you are told a nurse is a nurse. It is a demoralization to some of us who are yearning for higher level training. Can you comment a little bit on that one, Professor Ndirangu?
Thank you very much, Rashid, and thank you, Were, for that question. It's a critical question and indeed an important question. I think I can say so far what milestones have been met, That is not to say that there isn't much to do. There's a lot more to do. So far, the steps that have been made are, one, of course, getting the scopes of practice ready, approved, and launched by the Ministry of Health. That is a step in the right direction. The second activity that's ongoing that we did not manage to complete before the Kenyan elections, but hope to get back to, is a review of the scheme of service. You see, the scheme of service as it stands right now, usually, if you get above a certain job group, for you to grow, you have to move into the leadership position. So there's sort of like a ceiling, if I may use that word, for people who remain in clinical. And so in the proposal for the scheme of service is that you have the 2-tier tracks. If you remain in clinical setting and at providing care at the bedside, then you should also grow in tandem as somebody who then moves to leadership when they get to above a certain job group. So that's the second thing that we are working on. The third thing is we all need to believe and remember that this is not a journey and an activity that is only left for a few select people. This is something that every health professional who's a nurse and a midwife needs to get into. I believe one of the challenges we have in getting success in lobbying for things within the profession is that we leave it to a few people, but this is not a journey, or I don't use the word a fight because it's not a fight, but this is not a journey or I want to look for the right word, or a movement that is left to the select few. I think this is something that each of us needs to figure out. How do we, in our own small way, play a part? I'm honored to see Cecilia, who's our student, taking on the Nursing Now a challenge opportunity to sort of give us a voice to talk about APN. That is her doing something, yeah? So I'd also encourage all of us on the call to think about what is it we can do in our own small way, in our own big way, in our own little, big, small, whatever way you want to define, to be able to put this forward. I think the remaining part for me is figuring out how we synergize between what's happening at the national level with what's happening at the county levels. And I think we all know different counties are doing different things. And with decentralization, we need to bring that advocacy down to the county levels as well, so that it makes sense. But there are hospitals that are doing commendable work. I know, for instance, Gertrude's is employing APNs and actually sponsoring nurses to go and do APN in child health and pediatrics, because that's what the hospital largely emphasizes on. So there is steps in the right direction. There's a lot more to be done, but I would call all of us to be on that table to figure out what role we can play in this entire journey. Thank you.
Wow, that is wonderful. Thank you so much, Professor. That is all that I had. Over to you, Cecilia.
Thank you so much, Prof. And for that elaboration, especially in the Kenyan context, whereby all the pillars of nursing plays role in getting these policy documents done. And there's a research Nursing Now carried out with the previous, the last quarter, the last year. And this was basically to find out the 4 policy documents in Africa. And I hope that the publishing will be out soon and we'll be able to see our African countries where we are. And especially also the associations. The associations, they aim to build the professionalism. And I'm glad also working with NNK, that NNK is aiming and it is really armed to work on this document, and was one of the participants in taking up and coming up with a scope of practice for the APN program in Kenya. I'm glad to note that we have David Muli, who commented and said that David is from Cameroon. He's developing a master's module in advanced nursing practice in critical care for the University of Bandema in Cameroon. And I hope he will also be able to link up, because I believe this is the beginning of something good, that we will be able, as an African region, we'll be able to interconnect and see how we can build the APN, the advanced practice nurse, to advance the universal health care. Also, another comment from Eunice, from Debbie. She says that really insightful, Professor Eunice. Thank you. Health Education England have come useful documents that attendees today might find useful in terms of APN framework. There's a link in a chart whereby you can be able to access that. And Grace also says, truly grateful that Kenya has well defined the scope of nursing, but I'm afraid that there is still a gap in practicing due to insufficient clinical learning environment. I believe that has been well explained by Professor Eunice to be able to capture that. And also Teresia Muthoni, a student of APN program in Sonam. She says, great and insightful discussion, Professor Eunice and all the facilitators. Thank you so much, Teresia. From Debbie, Debbie Cromack, I hope I've spelled that correctly. She says, thank you for your words, Faith. Research is such a golden thread for the development of our early career nurses. Increasing confidence to contribute to the evidence base should be part of the day job for every registrant. And I really concur with that. And also to note that there's a code that's the code, the 4 pillars of nursing. I believe Professor Eunice has well elaborated on that. And yeah, I hand over to our closing remarks that will be done by Mohammed. Welcome, Mohammed.
Thank you so much, Cecilia. I would like to explain my sincere gratitude to our panelists today. They were fantastic. They have shared their experience from their own background. I was really enjoying the discussion, especially sharing the situation of APM practice in Kenya. Also, our colleague Faith Nawali shared her definition for APN prospective representation of Uganda. Also, it's great to hear from Malawi. I would like to emphasize that there's an important thing that to include advanced practice in Africa, especially we are shorting. And I'm happy that there is some countries in Africa, they start to introduce advanced nursing practice in their curriculum. I would like to call upon action to all nurses or young nurses in the African continent to start to work and to advocate towards more involvement of advanced nursing practice in the curriculum, especially at postgraduate program. Also, would encourage educators from all African nursing universities to include and to adopt advanced nursing practice curriculum as a master's degree. Also, I would like to emphasize the importance of having nurses who are going to work in the research field to produce evidence generation, which is very important for everyone to produce scientific and evidence-based documents which will help to achieve advanced nursing practicing. Also, would like to remember all of us, we are the backbone of achieving universal health coverage. As we know, universal health coverage is a central part of SDG Goal 3. I would like to call upon government officials to invest on nurses, because investing in nurses, you are investing in achieving universal health coverage, and in the same back, you are achieving SDGs in our country. So for me, that's all for today. I would like to thank all of you for fruitful discussion. Back to you, Cecilia.
Thank you so much, everyone. And feel free to get in touch in case you have any other further questions or query. You can reach to our Nursing Now team, and we'll be able to assist and get much further feedback. Thank you, and have a nice afternoon, everyone.
Thank you, and bye.
Thank you.
Bye.